Hi, I'm Dr. Jennifer Couturier, a professor within the Department of Psychiatry and Behavioral Neurosciences at McMaster University and medical co-director of the Eating Disorders Program at McMaster Children's Hospital. Eating disorders are complex illnesses that significantly impact the mental and physical health of those affected. There are many different types of eating disorders, each of which is characterized by varying symptoms. Although eating disorders often develop during adolescence or young adulthood, anyone can be affected, regardless of their gender, age, background, or body type. As such, it is important to ensure that everyone receives access to timely, high-quality, evidence-based treatment. That's where the Canadian practice guidelines for the treatment of children and adolescents with eating disorders come in. Accompanied by a virtual care addendum, these guidelines synthesize the latest and best available evidence on various eating disorder treatments for youth into partner-informed recommendations that can be integrated into clinical practice across the country. So what do these guidelines recommend? Let's start with some of the strong recommendations. For youth with eating disorders like anorexia or bulimia, family-based treatment, or FBT, is strongly recommended, especially for those whose illness has lasted less than 3 years. FBT focuses on equipping parents of affected youth with the appropriate tools to manage their child's eating disorder symptoms. Some virtually delivered treatment options, such as telehealth cognitive behavioral therapy, are strongly recommended. In this case, specifically for young adults with anorexia, bulimia, and binge eating disorder. For children and adolescents and young adults receiving virtual care, in-person medical evaluation is strongly recommended, depending on individual circumstances. Of course, youth in marginalized and equity-deserving groups should be provided equal access to treatment, whether that is virtual or in person. In general, treatment should be provided in the least intensive environment possible. That means that for children and adolescents who are medically stable, outpatient or day treatment programs are generally recommended. What about other treatment modalities? Other types of therapy, such as enhanced cognitive behavioral therapy or CBTE, are currently weekly recommended for anorexia and bulimia. Evidence is building in these areas. For ARFID, therapies such as CBT and FBT require further study to determine a recommendation for their use. In addition, yoga is weekly recommended as an adjunct to standard treatments for all types of eating disorders. While the Canadian practice guidelines help inform the care provided by clinicians, recommendations may not always be applicable to each patient's unique circumstances. Healthcare providers are encouraged to exercise their clinical judgment and make decisions alongside their patients and their families. For a full summary of the guidelines as well as clinician-focused synopses, please see the Couturier Lab website.